Story 1. My father was hospitalized for a week due to heart failure. He would have literally faced death without medical help. His lungs were filled with fluid, and he was effectively drowning. The insurance company decided that the entire stay was completely unwarranted because, according to them, it didn't seem like he was sick enough. They didn't want to cover anything related to it. While we were eventually successful, it took years to fight. The bill was in the six figures. Story 2. My dad is an oncologist, and he says there has been an uptick in the number of arbitrary denials by insurance companies for claims that should absolutely be covered under the patient's plan. When they are appealed, they will often eventually be approved. But the whole process moves really slowly, which can be a death sentence given early treatment is critical when dealing with cancer. It almost seems like the insurance companies are delaying things on purpose, in the hopes that the patient will die before they have to pay for treatment. Story 3. My daughter was born early and spent 7 weeks in the neonatal intensive care unit. When she got out, we received a bill for something like $400,000, and it took months to get the hospital and insurance company to sort it out. We have stacks of paperwork showing that everything has been settled, but every so often, we receive a letter or a call from one of them because they randomly decided that we still owe them $100,000. Story 4. My wife had an emergency surgery for a spontaneous retinal detachment, literally minutes away from going blind. Insurance tried not to pay because she had not gotten pre-authorization, and then after that, claimed a spontaneous event was a pre-existing condition. Story 5. In 2008, I went into the hospital for a ruptured intestine due to Crohn's disease. I was airlifted to Mayo Clinic high on fentanyl for the pain. I spent a month in the hospital and came out with no colon, looking severely underweight. My wife felt something was wrong and went to the obstetrician-gynecologist to check on the baby. There was no heartbeat at 8 months and they induced labor. We buried our son. We received a bill for $110,000 from Mayo Clinic, which the insurance company denied. We also received a bill for $20,000 for the procedure, which the insurance company denied. I spent 4 months making daily calls to the hospital and the insurance company, fighting the charges down to $12,000. Story 6. Not me, but someone I know was diagnosed with cancer in her early 30s. Her oncologist found cancer cells in her lymph nodes, indicating that it had metastasized. So he ordered a full-body magnetic resonance imaging scan to assess where it had spread to. Her insurance denied it because they said she was too young to be considered at risk, despite her actively having cancer. They did eventually approve it, but not without a lot of pressure from her doctor. Story 7. My daughter had a febrile seizure at 1 year old. She seized for more than 30 minutes, and when the emergency room got it stopped, she was paralyzed on her left side. The doctor thought she may have had a stroke, so they transported her via helicopter to a pediatric stroke unit. She did not have a stroke and instead suffered from what was called TODS paresis. Insurance refused to cover the $64,000 helicopter ride as they deemed it medically unnecessary. They could not tell me what the alternative was or what we should have chosen instead, just that a helicopter ride was not it. It took us nearly a year, multiple appeals, and the support of the hospital's board of directors to get insurance to cover their own terms. Story 8. My surgery to remove ovarian cancer was deemed elective. The type I had wouldn't respond to chemotherapy or radiation therapies, but since it wasn't going to immediately kill me, it was just because I wanted it, apparently. Had to pay $6,000 out of pocket. Story 9. I work for a durable medical equipment company. We exist solely for the shareholders in hopes of packaging and selling the company to a larger company like Medtronic. Our income is largely, perhaps mostly, based on overbilling Medicare. We waive patient costs all the time on the basis that we will still make record profits year over year if Medicare pays their part less than half the time they're asked to. This is happening at scale across the entire healthcare industry. The system is utterly vampiric. Healthcare could be so much cheaper if there wasn't an entire for-profit industry dedicated to exploiting our poorly constructed state health system. Story 10. My father was a doctor with a pre-existing condition before the Affordable Care Act, which meant the only health insurance he could get was through his state's pool of last resort. It took 30% of his income as he was self-employed and working in a very rural area. He was the only physician in his specialty for 75 miles, And when things got desperate for his patients, he would allow them to pay in piano lessons, vegetables, or whatever they could instead of cash if they needed to. He had a stroke and died on his bathroom floor but lived on life support for 4 more days. $350,000 later, including a $70,000 helicopter flight for 30 miles, a man who dedicated his life to medicine and donated all of his organs to science died with less than nothing because of healthcare costs. Story 11. My girlfriend had kidney failure as a child and had been on dialysis for over 15 years. She graduated college and was working as a teacher. She had to stop due to complications with her condition and go on disability. This was before the Affordable Care Act, so we tried to get coverage from all the insurance companies since it is impossible for anyone to afford dialysis without insurance. Every single company declined to cover her due to her pre-existing condition. They essentially told her that she was too expensive to live. Story 12. My wife just got her 3rd denial for authorization from United Healthcare for an MRI on her hip that her doctor has been trying to get for her for over a year. The first reason: she didn't submit x-rays. Submitted x-rays and reapplied. The second reason: she hadn't done physical therapy before the request. Submitted evidence that she has done physical therapy on and off for 7 years with no improvement and reapplied. The third reason: she needs to have x-rays done first. This AI auto-rejection cruelty is par for the course. Story 13. Husband was getting a stem cell transplant to treat his stage 4 lymphoma. The morning of the procedure, the hospital realized we didn't have insurance because he had recently lost or quit his job, ran out of Family and Medical Leave Act, and the previous employer had not submitted the paperwork to Consolidated Omnibus Budget Reconciliation Act. We had to contact them to fax a form, and I had to write a check for $1,600 to cover the previous 2 months of Consolidated Omnibus Budget Reconciliation Act so his transplant could proceed. If my sister hadn't gone to high school with that transplant coordinator and I didn't have $2,000 in my bank, he wouldn't be here today. Story 14. Far less severe than what I'm sure will populate this thread, but a terrific example of the nonsense that is American health insurance. During COVID-19, I was working for a Hawaii-based organization, but on the East Coast. Someone in my office tested positive for COVID-19, so everyone in the office went to a testing site to get tested. My claim for the COVID-19 test was denied because I didn't go to one of the approved testing sites for my insurer. All of the approved sites were in Hawaii. At the time, you couldn't travel to Hawaii without proof of a negative COVID-19 test. So the only way I could get the cost of a COVID-19 test covered was if I went to an approved testing site, but in order to travel to any of the approved testing sites, I needed to show a negative COVID-19 test. Story 15. I got hurt at work and suffered an amputation on site with no pain medication. They slowly pulled my toes off with my crushed boot. My family lost our health insurance at the end of the month because I wasn't working. But it's okay. Consolidated Omnibus Budget Reconciliation Act was only $2,500. Story 16. I got super sick when I was 7 and had an extended hospital stay. Unfortunately, it happened during a brief lapse in my dad's employment history, so we were briefly between insurance. I later found out my parents went bankrupt, and my dad had to take on higher-paying jobs he hated in order to pay it off. He eventually worked himself to death, almost literally. He worked so many hours of overtime he fell asleep at the wheel, drove off the road, and crashed into a tree. Worst day of my life. He should have been enjoying his retirement by now. Instead, he's been gone for years, and my mom still struggles with depression and being a widow. America needs universal health care. Story 17. I worked in billing, and the number of patients scammed by Medicare regarding their yearly physical is concerning. Yes, it's free, but if you deviate on anything, it's not free and you are charged for it. So don't tell your doctor your knee hurts or you have a hangnail during that visit. Also, check your insurance for colonoscopies. If you do the Cologuard at-home test and it comes back positive so you have to go in and have an actual colonoscopy, it may not be covered as preventative, and you'll get charged. Story 18. Our daughter was born prematurely around Christmas and spent 3 weeks in the neonatal intensive care unit. After a week and a half, she was downgraded from neonatal intensive care unit level 2 to neonatal intensive care unit level 1. Nothing changed. She was in the same unit, in the same bed. She just was no longer on a feeding tube. Insurance counted her downgrade from level 2 to level 1 as a new admission rather than a continuation of care. Because we had crossed calendar years, her new admission was subject to a new calendar year of copays, deductibles, and maximum out-of-pocket expenses. That meant that for a single 3-week neonatal intensive care unit visit, we were charged maximum copay, maximum deductible, and maximum out-of-pocket expenses against 2 years of coverage. We fought it for over a year before the hospital threatened to take it to collections, so we eventually gave up and paid it off. We had a good policy, and the maximum out-of-pocket for each year was only $4,500, for a total of $9,000 for a neonatal intensive care unit bill that exceeded $350,000. But that extra $4,500 for a second year we knew we shouldn't have been required to pay sure stung. Story 19. Not me, the mother of my wife's work friend. Her house outside of Gulfport, Alabama, was flattened by Hurricane Katrina, and she spent the rest of her life living in hotels and rentals while her home insurance and the government-managed flood insurance argued over whether a storm surge is wind or flood damage. Story 20. Definitely not as bad as others for sure, but being a type 1 diabetic, you basically are at the mercy of drug prices. South Dakota also only has 2, if you're not on a corporate plan, health insurance companies, which, ironically, are part of the 2 health systems in the state, Avera and Sanford. My insulin copay seems to change constantly. The real issue that's stuck in my mind is my blood work. I went to a small clinic or hospital to get work done and was charged over $800 for routine blood work that typically costs me around $30. I called the clinic and asked why it was so expensive. They said it was because the test was taken in the hospital and not the clinic. That's just their policy. This was a while ago, so I'm not entirely sure if it was a policy of the medical side or insurance side, but since Avera is both the healthcare and insurance company, I guess it doesn't much matter. Months later, I mentioned this to my endocrinologist, who then mentioned Quick Labs. It's an unadvertised blood test that covers everything I need for $75. Of course, this is unadvertised. Anyway, my fellow South Dakota diabetics, ask for Avera Quick Labs if your current blood work is very expensive. No appointment is necessary at participating facilities. Story 21. For my first pregnancy, everything was covered under my plan without issue. For my second on the same plan, I figured it would be the same. It turns out the company decided that they would only cover office visits, and any lab work was not included. No blood work, no ultrasounds, nothing. When I called to get clarification, they were very vague and would just keep repeating, "Office visits are fully covered." But what does an office visit include? Office visits are fully covered. I was directed to check my plan, which was just as vague. After paying for everything out of pocket, my child had the audacity to be born 2 months into the new plan year, so we had to start all over with the deductible. Story 22. I moved to Georgia and had to apply for Medicaid because my job did not offer insurance. I received an official letter stating, "You qualify for Medicaid. However, we are not going to give it to you." Since Georgia had refused to participate in the federal Medicaid expansion, I went without insurance for the next 2 years and almost died. Story 23. I've gone over 10 years with a rotting wisdom tooth since I haven't been able to afford the extraction. I got denied at my last municipal job and ended up finding another where I would qualify after 6 months of probation. Story 24. Not much of a horror story, but more of a how is this a thing? It doesn't make any sense type of story. I had to get a type of scan. It was actually cheaper to pay out of pocket than to go through my insurance. It would have cost me an extra $50 if I went through my insurance. Story 25. So, I am a diabetic. My doctor wanted Lantus insulin, but insurance wanted another, cheaper insulin that's not as effective, the Sagler. So my doctor doubled the dosage. So my insurance decided to make the dosage 2 times 14 days worth, 2 weeks a month, instead of 30 days worth, so I had to pay the copay twice a month. That meant 28 days a month, and most months except February have more than 28 days. I ended up having to ration my insulin, and the copay went from $25 for 14 days to $65 for 14 days in less than 2 years. That meant I had to go to the pharmacy, stand in line, and get refills every 14 days. And the pharmacy ran out a lot, so I had to come back. I can't drive, so I had to walk a mile to CVS down the road for this and other medicines. I just started buffering a week at a time just so I could deal with this inconsistency. How come your blood sugar never goes down? The doctor asked. I told him, and he shook his head, saying this was so common. He tried swapping insulin types or increasing the dosages, but insurance said no. My A1C was like 10. Then I ended up on TRICARE because I married someone in the military. I got Lantus, Trulicity, and boom, my A1C dropped to 6 in less than a year. I know the military has efficiency issues, but I pay nothing out of pocket in TRICARE. No copay, no prescriptions, and no fees. It's like $58 a month from my wife's pension for the both of us. I mean, socialized medicine will work in this country. The companies just don't want it to. When my first wife died, the military officer was my second marriage. Her insurance dropped her because she was dead. Then they sent her a $230,000 hospital bill for her last week of life because she was on a ventilator in critical care. No, I don't live in a communal property state, but they sent her to collections and heavily implied, illegally, that I had to pay. I didn't. Let me repeat this. They sent my dead wife to collections, then lied that I had to pay because she was dead. Bill collectors called me at work, called our son, and even my sister. Not her sister, my sister. I had legal notices and bills for her, in her name, coming as late as 8 years after her death. In fact, twice she had a summons to go to court. Then a summons for arrest for failure to appear in court. However, that sheriff had common sense and took her death certificate. He even said he was sorry for bothering me. It was crazy.